somewhere in your office or your workplace, and you probably also have some questions about how to use the AED. If you'll give me a couple of moments today, I'm going to go through a quick 3 to 4 minute video on just how to use the AED and why it's so important. The importance of accessing and actually using the AED can be the difference between survival for the victim. If you look at the statistics that are out there, we can see that any delay, even a momentarily delay in using the AED, decreases the chance of survival for your victim by 10% per minute. So what that translates to is that the person may have less than a 10% chance of survival after 9 minutes have passed. Today I want to introduce you to the AED and how to use it. So let's open the AED case. So you may have to actually go out there and retrieve your AED from your office, wherever it is stored at, and then just open up the case. So let's see what's inside. So the first thing we have, you can see that you've got the AED, and then generally also somewhere in the case you're going to have some paper towels or some type of cloth that we can use for cleaning off the chest, usually drying off the chest. Really don't have to be too awfully concerned with that, but it is nice to get excess water off. The other thing that you might have is a razor in your AED case. You may have this, you may not have it. Don't get too fixated on it if you do not have it. If you have a razor there, we can use it to clean off chest hair. If you don't have it, we can work with that as well. The other thing, the last thing that you probably will have in your AED are going to be the pads. You're going to probably only have adult size pads in your case. Occasionally you may come across an AED that is out for public use that may also have a child size set of pads. Don't worry about that also, because they're very easily identified. The AED child size pads are about half the size of the adult pads, and many times they're also denoted with either like a bright pink or a bright blue color, so that it makes it really easy for you to identify whether you have adult pads or pediatric. Okay, so now for use of the AED. The first thing that you are going to do when you open your case is you're just going to turn the AED on. You really cannot do anything until you turn the AED on. So if I push this button, it's a real easy identified button. There's only a couple on the front of the AED, no matter what kind of AED you have. They all are very simple to use. So I'm going to push the power button, and as soon as I push the power button, the AED is going to immediately start to give commands. That is when you need to start to really pay close attention to what the AED is telling you to do. So when I push the power button,
apply pads to patient's bare chest.
So it's going to tell
Plug in
me.
pads connector next to flashing light.
It is telling me to apply the pads and then where exactly to plug in the connector that goes to the pads.
Apply pads. Plug in connector.
It's going to continue to give those commands until you actually do what it tells you to do. So once you've got your pads in place, and you can see that we want to apply one pad to the upper right hand side of the victim's chest, and the other pad is going to go to the left hand side of the victim's chest, right below the nipple line on the left side. What you are trying to do is to align the pads diagonally across the chest so that the heart is what is in between the pads, because if we're giving a shock, the shock needs to go and travel from one pad to the other pad through the heart. That is what we're trying to accomplish there. So the pads are placed in this diagonal position so that that electric shock can travel from one pad to another, passing through the heart. Once the pads are in place, the AED will then start to analyze, and will actually say, it will say analyzing. At that point, it will also tell you to stop CPR, stop compressions. It will say, do not touch the patient, because it is trying to analyze exactly what is going on with the patient or the victim's heart at that time. If the AED detects what is considered a shockable rhythm, a rhythm that it actually can deliver a shock for and that the shock will benefit the victim, then it will give the command, shock advised. It will also start to charge itself. So it will charge till it is to the point where the shock needs to be delivered. Once it reaches that point, unless you have a fully automated AED, which those are more of the rarity, you will actually have to be the one that depresses the shock button. Before that, you need to stop. You just have to stop for just a second. You need to make sure you are clear of the victim, and you need to make sure that all is clear, that no one is actually touching the victim. Once you have secured that, then you may depress the shock button and deliver the shock. Once the shock is delivered, the AED will then continue to analyze the victim. It may advise another shock. It may advise up to 3 shocks before it asks you to resume CPR. The main thing to remember is once you have the pads in place, the AED on, the AED will guide you through the steps of what to do next. It actually tends to calm down the situation because people tend, even rescue people, tend to get very excited when we have a victim that is in cardiac arrest, and especially for the layperson that doesn't have the experience of a regular healthcare provider, it can be a very, very stressful situation. So if you allow the AED to guide you, it can calm the situation, and the AED will walk you through each step on what to do. So I hope that you've learned a little bit today about actually how to apply the AED pads, turn on the AED, and actually what to do if you need to act in a cardiac arrest. Thank you.